Everything you thought you knew about prostate health might be a lie. For years, men have been told the same misleading advice that could be making things worse instead of better. What if the biggest health tip you've heard isn't true at all? What if following it blindly is putting you at risk? Too many men fall for this myth, and it's time to set the record straight. Ignoring this truth could lead to serious problems down the road. Stay with me, because once you hear this, you'll never look at prostate health the same way again. First, we have an enlarged prostate means you have cancer. One of the biggest reasons why the belief that an enlarged prostate equals cancer is false is that BPH is caused by hormonal changes, not cancerous cell growth. As men age, testosterone levels decrease while estrogen levels remain stable, leading to an imbalance that can cause prostate cells to multiply. This enlargement is not due to malignant tumors, but rather a natural response to aging. Prostate cancer, on the other hand, occurs when abnormal cells in the prostate begin to grow uncontrollably, potentially spreading to other parts of the body. Medical tests clearly differentiate between BPH and prostate cancer, further proving that an enlarged prostate is not necessarily cancerous. A prostate-specific antigen, PSA test, digital rectal exam, DRE, or even a biopsy can determine whether a man has cancer or simply BPH. High PSA levels can sometimes indicate cancer, but they can also be elevated due to BPH or even an infection. Doctors rely on multiple tests and evaluations before making a diagnosis, rather than assuming that an enlarged prostate means cancer. Another reason why this belief is misleading is that many men with BPH never develop prostate cancer. If an enlarged prostate were directly linked to cancer, then nearly every older man would eventually get diagnosed with it, which is not the case. In fact, many men live their entire lives with BPH without ever experiencing serious health issues. While having BPH may slightly increase the risk of prostate cancer due to inflammation and cellular changes, the two conditions do not always go hand in hand. Misinformation about prostate health can lead to unnecessary fear and anxiety. Many men delay seeking medical advice because they assume that an enlarged prostate is automatically a death sentence. In reality, early detection and proper medical care can manage both BPH and prostate cancer effectively. Lifestyle changes, medications, and even minimally invasive procedures can help manage BPH symptoms, while prostate cancer treatment options vary based on severity and progression. Understanding the distinction between these two conditions can prevent panic and encourage men to take charge of their health. The idea that an enlarged prostate automatically means cancer is a myth that continues to circulate despite clear medical evidence disproving it. While both conditions affect the prostate and may share similar symptoms, their causes, risks, and treatments are very different. Instead of assuming the worst, men should prioritize regular checkups and screenings to ensure their prostate health is monitored properly. Awareness and education are key to dispelling this myth and ensuring that men make informed decisions about their health. Next, we have diet has no impact on prostate health. The idea that diet has no impact on prostate health is a misleading claim that can prevent men from making better lifestyle choices. Research has consistently shown that what you eat plays a significant role in maintaining a healthy prostate and reducing the risk of conditions like benign prostatic hyperplasia, BPH, and prostate cancer. A poor diet high in processed foods, unhealthy fats, and excessive red meat has been linked to inflammation and hormonal imbalances, both of which contribute to prostate problems over time. Ignoring the role of diet means overlooking a key factor in prostate health management. One of the strongest pieces of evidence proving this myth wrong is the link between prostate health and inflammation. Diets rich in processed sugars, refined carbohydrates, and unhealthy fats contribute to chronic inflammation, which can worsen prostate issues. On the other hand, consuming anti-inflammatory foods such as tomatoes, leafy greens, and berries can help reduce inflammation and support overall prostate function. Lycopene, a powerful antioxidant found in tomatoes, has been shown in studies to lower the risk of prostate enlargement and even slow the progression of prostate cancer. Another reason diet matters is its impact on hormone levels, which are directly linked to prostate health. Excessive consumption of dairy and red meat has been associated with higher levels of insulin-like growth factor, IGF-1, a hormone that may increase the risk of prostate cancer. Additionally, a diet high in unhealthy fats can disrupt testosterone balance, leading to increased production of dihydrotestosterone, DHT, which is known to contribute to prostate enlargement. In contrast, a diet rich in plant-based foods, healthy fats, and fiber helps regulate hormone levels and reduce the risk of prostate-related conditions. Nutrient deficiencies caused by poor dietary habits also contribute to prostate health issues. For example, low levels of zinc, selenium, and vitamin D have been linked to an increased risk of prostate disease. Zinc, found in pumpkin seeds and shellfish, plays a crucial role in prostate function, while selenium, present in Brazil nuts, has been studied for its potential role in reducing prostate cancer risk. A well-balanced diet ensures that the body receives these essential nutrients to support optimal prostate health and function. The impact of diet is further supported by population studies comparing prostate health across different countries. In regions where traditional diets are rich in vegetables, legumes, and fish, such as Japan and Mediterranean countries, prostate disease rates tend to be lower. In contrast, Western diets high in processed foods and unhealthy fats are associated with higher rates of prostate enlargement and cancer. This stark difference proves that dietary choices play a fundamental role in shaping prostate health outcomes. Next, we have drinking more water always improves prostate health. Drinking water is essential for overall health, but the idea that simply drinking more water will always improve prostate health is misleading. While staying hydrated supports kidney function and helps flush out toxins, excessive water intake does not necessarily prevent or treat prostate conditions. In some cases, drinking too much water can even worsen certain prostate-related symptoms, particularly in men with an enlarged prostate or other urinary issues. The belief that more water is always better oversimplifies the complex relationship between hydration and prostate health. One reason this claim is false is that excessive water intake can increase urinary frequency and urgency, which are already common issues for men with an enlarged prostate. When the prostate enlarges, it can press against the urethra, making it difficult to fully empty the bladder. Drinking large amounts of water throughout the day can put extra strain on the bladder, leading to more frequent trips to the bathroom, especially at night. This can disrupt sleep patterns and negatively impact overall well-being. Another issue is that water alone does not address the underlying causes of prostate problems. Conditions like benign prostatic hyperplasia, BPH, and prostatitis are influenced by hormonal imbalances, inflammation, and lifestyle factors. Simply drinking more water will not reduce prostate enlargement, lower inflammation, or balance hormone levels. Proper dietary choices, targeted nutrients, and medical treatments are far more effective in managing prostate health than excessive water consumption. In some cases, overhydration can dilute essential electrolytes like sodium and potassium, which are crucial for muscle and nerve function, including those involved in bladder control. When sodium levels drop too low due to excessive water intake, a condition known as hyponatremia can occur, leading to fatigue, confusion, and muscle weakness. Maintaining a balance between hydration and electrolyte levels is key to supporting both prostate and bladder health. The quality and timing of water intake also matter more than simply drinking large amounts. Sipping water throughout the day instead of consuming large quantities at once can help prevent unnecessary bladder irritation. Additionally, drinking too much water before bedtime can contribute to nocturia, the frequent need to urinate at night, which is a common complaint among men with prostate issues. Moderation and mindful hydration are far more beneficial than blindly increasing water intake. Last, we have only older men need to worry about prostate health. The belief that only older men need to worry about prostate health is a dangerous misconception that prevents younger men from taking preventive action. While prostate issues like benign prostatic hyperplasia, BPH, and prostate cancer are more common in older men, that does not mean younger men are immune. Prostate health is influenced by factors such as diet, lifestyle, genetics, and inflammation, all of which can affect men at any age. Ignoring prostate health early in life can lead to problems later on that could have been prevented with better awareness and habits. One of the biggest reasons this claim is false is that prostatitis, an inflammatory condition of the prostate, often affects younger men. Unlike BPH or prostate cancer, which develop over time, prostatitis can occur suddenly due to bacterial infections, stress, or pelvic muscle dysfunction. It can cause symptoms such as pain in the lower abdomen, difficulty urinating, and even sexual dysfunction. Many men in their 20s and 30s experience prostatitis but may ignore the symptoms because they believe prostate problems only happen to older men. Another reason younger men should care about their prostate health is that lifestyle habits formed early can influence future risk. A diet high in processed foods, excessive alcohol consumption, smoking, and lack of physical activity can contribute to inflammation and hormonal imbalances that may increase the risk of prostate disease later in life. Making healthier choices early on, such as eating more antioxidant-rich foods, exercising regularly, and managing stress, can help protect the prostate from future complications. Even though prostate cancer is rare in younger men, it is not impossible. Some men in their 40s or even late 30s have been diagnosed with aggressive forms of prostate cancer, especially those with a family history of the disease. Early detection is crucial for successful treatment, and waiting until old age to start screening can allow cancer to develop unnoticed. Men with a family history of prostate issues should start monitoring their prostate health earlier, rather than assuming they are too young to be at risk. Fertility and sexual health are also linked to prostate function, making it important for younger men to pay attention to their prostate health. The prostate produces seminal fluid, which is essential for sperm health and mobility. Chronic inflammation, infections, or poor lifestyle choices can affect prostate function, potentially leading to reduced fertility. Ignoring prostate health until later in life could result in avoidable reproductive issues that could have been managed with proper care.